Welcome to A Mexican Crossing Lines with your hosts, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM KPPPLP Fargo, Moorhead, where we are adding local color to your airwaves. Tonight, I am going to talk about the lockdown lunacy. I'm sure that it is hitting your neighborhood, your neck of the woods right about now with the lockdown that most people are on in almost all of America, except for Iowa for some reason and North Dakota. And I think there's a few other states too, Duke, that just don't want to lock down for some reason.
Yeah.
How many is there?
I can't understand why they're not. They just aren't. And they got different degrees of separation. I got a little problem with mic here.
Let me
Check. There we go. Got it back up there.
Great. I just wanted to talk about that because however you feel, whether you're one of the people going crazy under this lockdown or you're observing people near you losing it, it's something we need to address. It's something that we need to deal with. It's happening in my own extended family and circle of friends. I see it in my community. I see it in other states. We're going to talk about it tonight. I'm also going to update you on everything local and national and international that's going on with this virus, the most important pieces of information to help you get information on food, groceries, food assistance, farmers with produce in the community, products that you can buy from locally, food infrastructure, volunteers, emergency funds for different food systems, all sorts of different information we're going to tell you about today on A Mexican Crossing Lines. But first, I want to thank all of you who have sent me information. There's no way I could curate so much information from so many places. You're sending me what you see here in the United States, in Canada, and Mexico. And I really appreciate it because you're helping all of the communities that listen to my program stay safer. You're helping people find out where the frauds, where the tricks are, and you're helping people stay safer in this pandemic. So I really appreciate you. I thank you for sending me comments, show ideas, articles, etc. Also for supporting our station during these pandemic times. Donating to local media is more important than ever. Duke, how can folks support our work and follow us?
Well, thank you for also joining us tonight. And we're considered an essential service. The media is one of the essential services that, we need to keep on doing this work. And we are structured in a way that we can. And a lot of the reason for that is because we have you that's helping us do that. I mean, you've sent in the information, more information we could ever cover in the amount of time that we actually do shows during the day. But we thank you. Keep on doing it. Very much appreciated. We use Facebook a lot, 88.1 FM Fargo Moorhead on our Facebook page. We're streaming on there. We're also streaming on YouTube at Duke 1517. You can send information to our Facebook page. We also have the People's Press Project, a Mexi-Can. If you want to call us and leave a voicemail for us and a voice message, 701-566-0917. 701-566-0917 is that number. You can also email Cindy at kpppfm.com or me, Duke, at kpppfm.com. You can tweet us at media_PPP. And don't hesitate to go to kpppfm.com and look for our most recent shows, which I have not gotten updated. I was going to do it this weekend for some reason. I thought I did and it didn't. But was the weekend here? Is this still the weekend? I don't know. I think it's one of the days of the week. So, I get a little confused sometimes because we are in a pandemic and we are isolated here in our studio or our house in our neighborhood, not leaving. And we are having our contact with you through the internet. And please contact us and send more information. And when you're at kpppfm.com, don't hesitate to go to our donation page. It's kpppfm.com/donate. Make a donation. It's tax deductible. It helps us run the station, helps us do our work, keeps us on the air, and keeps us going. And thank you for your support.
Now, I have a public service announcement, and it's very important that you listen to what I'm about to say. It is now confirmed by our national intelligence agencies that China underreported the fact that over 20 million Chinese people shut their phones off during the pandemic forever. Like they got rid of the account, done, over with. Now, there is a lot of speculation as to why that is, and I will talk about that. Part of it is the theory that China underreported the deaths of 20 plus million people because they didn't want people in the world to know, blame them, sue them, go after them at some other point in time after the pandemic is over for lying so massively to the rest of the world and for letting this get out of control. But other people, including many of the Chinese government agencies and phone companies, responded that the most Chinese people have two SIM cards, two different or multiple devices, I'm assuming, and that during the pandemic, when everybody's economy and ability to work went down, they just kept one essential mode of communication for like a whole group of people, and all the rest of them got shut down. I don't know. I don't know. It's really hard for me to imagine the circumstances under which the incredibly unique and tragic circumstances under which 20 plus million people would get rid of what in China is the only way you can pay for things, track you, allow you to be able to go out into the world and scan all those things that you have to scan and register for. I mean, the government there in communist China, they track your phone. It's just a thing they do. They know everywhere. You have no freedom there, right? So it's not like people are like, oh no, I don't want to have my phone on during the pandemic because I don't want people to be able to track me. It's you can't get away from it. So it would be a really extreme thing for someone to basically throw away their only form of identification during a pandemic that allows them to pay for food and all this other stuff and just get rid of it, just cut it off. That would be really weird. I think that it's strange, but it's also possible, especially if people in super, super hard economic times really just don't have the means to keep things on, or things get shut off by the company, right? So it's possible that could happen here. In fact, I'm going to go ahead and say it's probable that people aren't going to pay for extra phone lines, extra data. Everything is going to be bare bones. I don't think people are going to be hooking up satellite services and all these other things right now.
No, in fact, it's hard to even, get that stuff. You have to work with the essential things you have. Our cable company actually contacted all the customers today, and I read through what they were going to do. They aren't even going to come and they'll set you up for your internet, and they're going to give you a kit. And they're not going to even come in your house. They're going to drill through your wall, but you have to help them figure out where to drill. But you have to hook it up. And that way they don't have contact with you, but they want to make sure you have your services. Now, we're not going to be able to have any money to buy anything because you're going to get your stimulus check, your $1,200. How long is that going to go? There's 60% of the people in this country that pay rent haven't paid their rent. It's like 60 million people have not paid rent, and a lot of landlords are leaning on them. And
the average amount of that money that you would have to pay out in rent is almost half for most people.
Yeah, or the whole thing by the time you get your check, you're half a month behind, and
could be late already. Mm-hmm. So this is why we recommend one of the most important things you can do for anybody, and I mean anybody, your elderly relatives, your neighbors, your friends that are disabled, people that are low income, elderly people, especially people that are not good with technology like phones and computers, and people that are homeless or unhomed at the moment and don't have a means of keeping their phone data up, or having a place to plug into something. Get these folks a radio.
Yeah.
Get them a radio now. Buy them a radio. Get one at the thrift store. Buy them a transistor. Buy the ones with the you can use with the batteries. These are things you need to have in an emergency. Preppers will tell you, and if you get one of those battery things that has all those plug-ins, they usually have like a radio on them.
Yeah.
You know why? Because during global emergencies, you need to get information, and you need to be able to do it even if you're out in the sticks, even if your power goes out, even if, you need to have a radio for an emergency.
Yeah, weather radio has actually the alert system and all the channels on it too.
Right. So what I'm saying is, get a radio. If you don't tune it to our station, if you're not local, find what local station near you is broadcasting information about the coronavirus, about the local community, about orders, about information that people need to know about where to get food, resources, medical supplies, all of the things that we need to know during a global emergency, a pandemic in our country. You need these are things that are essential. If you're working toward trying to help people in your community be safe, don't wait until their cable gets cut off. Don't wait until their phone gets cut off. Don't wait until they don't have money in their account. Don't wait until you can't get a hold of them anymore, and they can't get a hold of anyone else, and they have no way of getting information. Get them a radio now. I have a mom right now who is in Mexico. She is stuck in Puerto Vallarta, and she had her phone cut off. I don't know why. I don't know if she didn't pay her bill. I don't know what happened. But there is no way for her to get information, and there's no way for us to get a hold of her. If you get someone a radio, they won't be cut off from the information and the resources that are in their area. So we need you to do something now to make sure that all the people around you have a free, relatively free, cheap source of information, and that is the radio.
I have a technology tidbit. Remember, I've talked about your phone's having a radio chip?
Yeah.
Now, if you didn't have service with this phone anymore, the radio still works. The radio can tune to local radio stations. It uses the
antenna from your
headphones. Headphones. And phones, most of the newer phones have a radio chip. All you have to do is tune it to your local stations. That's another option. And you might even you just upgraded to a new phone, and your old phone has a radio chip. That's the radio you can give someone. They don't need to call. It's not a phone for calling. It's a phone for listening to the radio.
Fantastic. Okay. Well, sorry, I just got a notification from my brother that my mom is okay. Woo! Just breathe a sigh of relief. She finally was able to contact us. I don't know how. I'm not going to find out till after the show.
Yep.
But seriously, don't wait until the person that you care about gets their utilities cut off.
Mm-hmm.
And the phone, the internet, those should be a utility. They're not, folks. Did you know that? Did you know that they're not considered a utility? Everyone was given a landline and access to phone under Title 2. Or is it Title? I can't remember. It's one of the titles.
Yeah.
As a utility. I think it's Title 2. I could be wrong. I think there's 2 of them. But point is that in designating a necessary way of communication, especially in emergencies, that all people can share, that all people can use regardless of their income, regardless of their ability to pay from month to month. It's essential. And we don't have that right now. And in this global pandemic, it is becoming very clear why our past governments did that. But that was before we had cell phones. And we haven't done anything to catch up to technology. And because of that, a lot of people are going to be disconnected and not have access to emergency information. So folks, try and get the people that you know near you a radio. Now let's go to the world numbers here and find out how we are doing in terms of total COVID cases in the whole world. Right now, we have in the world total confirmed 2,019,320 cases. Oh my gosh, it's over 2 million now.
Yeah, it's over 2 million. These numbers were a couple hours old, and we're well above 2 million now.
Mm-hmm. How much is that up?
Oh, it's over 10,000.
Wow, that's a lot.
Yep.
In a very short amount of time. And in the total deaths, we have 119,483 worldwide. Total tested people in the United States right now is 2,935,006. How many millions of people live in the United States?
325 million.
And only 2% or 2 million of them have been tested. That's like about 2%, right?
Not less than that.
Okay. But my point here is we're woefully under-tested so far.
Yes.
For the coronavirus, we should be having testing that is in lockstep with getting a better idea of who currently has it and who's already had it. So having an antibody test that's available soon-ish, the faster the better, would be huge, because then we could find out really how far this spread. But folks, there are other means, other ways that our science is coming up with to try to get an idea of exactly how many people in our communities, in our states, have already gotten it without us figuring it out. And I'll tell you about that coming up. It involves testing our sewer water.
Oh.
Yeah. Isn't that interesting?
Yep.
In the United States, we have, oh my goodness, is this, oh wait, okay. I just, excuse me. It gave me the whole world number, and I thought, how did we leap that far?
Oh.
Coronavirus cases in the U.S. currently are at 586,748 cases. And we have a total deaths in the U.S. of 23,618. Recovered are 36,218 cases. And also, I wanted to show you how we are doing as far as the states go. In our states, so you can get a better idea of the big numbers that we have out in New York, they are at 195,655 cases right now. That is almost 200,000 cases, with 6,240 new cases, with 10,056 total deaths, 671 of those being new deaths. It's a staggering number. There are 168,000 active cases. Wow. And then if you look at the total tests, they've only tested not even 500,000 people.
Wow.
How many people live in New York City alone? Like 20-some million, isn't it?
Yep.
See, like, I think that just as long as we don't have a way of testing, it's gonna be awful.
Yeah.
I mean, it's gonna be really, really awful. New Jersey is up to 60,000. Massachusetts, it's up to 26,000. Michigan is up to 25,000. Pennsylvania is up to 24,000. So is California. So is almost Illinois. Florida is 21,000. Louisiana at 21,000. It's very bad. Duke, tell us about Minnesota and North Dakota.
Okay, in Minnesota, We have 1,621 confirmed cases. 842 of those have recovered. There's been 70 deaths. And we have 29 confirmed cases here in Clay County. For some reason, I think that number is higher, but this is the information I got off of the website before the show. In North Dakota, we have several things going on. We actually had another death. It says 8 deaths, but we have a 9th death that's happened between these numbers coming out and today, because they're always behind in the numbers. But they have basically 331 people have tested positive from and 23 new individuals since yesterday. Not a lot of people in the hospital, but 1 more in the hospital, 6 more have come through it. And then in Cass County, of those ones that were positive, we got a bunch of new people. I've been talking every day that Fargo is the largest city in North Dakota, and Cass County is the most populated in North Dakota. And they have not been doing enough social distancing, and the governor refused to put that into effect. So we're getting more and more cases, and they're younger people. It's more and more younger people each day. A man in his 20s from Cass County, a man in his 70s, 40s, 20s, 50s, 30s, 60s, and 20 from Cass County. So those numbers have been going up and up and up.
Wow. Something that's also really disturbing is what you told me about Iowa.
Yeah.
And specifically what you told me about Muscatine County, which is the county where my family lives. Mm-hmm. And tell folks what you told me.
Oh, it's that Muscatine County is the highest number of positive cases in all of Iowa. And it's not a really big county either.
No.
But it's the highest cases.
It's not the biggest county.
Nope.
It's not even in the top 3. I mean, it's a rural county.
Yeah.
The county seat is the town of Muscatine, which is where I grew up, and it only has around 30-some thousand people. Well, maybe closer to 40 now. But my point is still valid.
Yeah.
This is not a big place, and yet they're, and it's because there's no rules, and people are acting like, it makes it really hard, too, when you don't have any leadership that is telling people you can't do this because you're putting other people at risk. You can't make decisions for just yourself. If the pandemic is teaching us anything, it is that we cannot be selfish. We can't be about me, and just me. Everything you do is going to affect everyone in that household that you are quarantining with. So if you decide to pop in and pop out and pop in and pop out, one of those times you could bring back the coronavirus and kill your family, the whole family.
And what's hard with the leadership is that, I have to, reassure you that Tim Mahoney, who's the mayor of Fargo and the mayor of West Fargo, last week decided to have kind of a stay in your home type order. It wasn't
kind of a stay.
It was like, yeah, just do this. It would be better, but it's not really mandatory, because I don't think they want to make people mad. They don't want to put people into a panic, but the governor's not going to do it. And they felt it was very important because so many cases have been going positive in the Fargo area that this distancing has to happen, has to be done right. People have to be quarantined. They have a travel ban. If you go into North Dakota, if you're traveling outside the state, you have to be quarantined for 14 days, self-quarantined. And today, just before the show, I saw that they took the Fargo Dome, which is a big arena in Fargo, and they have put in 200 portable beds set up on the floor of the Fargo Dome to help manage a possible surge of patients. So Fargo is getting prepared for a lot of people to be, that you'd have to fill the dome when we have major hospitals here. I'm glad the city leaders are doing that. Hope it never has to be used, but it's prepared, which also tells me they're prepared for people needing a lot more medical care than is happening now, because the numbers keep on doubling and doubling and doubling. So they're only just going to go up until we hit that, flattening of the curve. That's not happened here yet. We're still on the rise.
Thank you very much, Patty Armstrong. I am going to take you up on that. Please DM me your phone number. I'm very, very concerned because my mother is in Puerto Vallarta, but I have so many people in Mexico that I love. In fact, Marco Antonio Barrientos Deras Saludos desde Minnesota. Our correspondent in Mexico City, I hope to be connecting with you, sir, very soon to talk about what is happening in Mexico City, because we have somebody right there that can give us reports on what is happening in the big city. Saludos a ti. Estaremos en contacto. Guys, we have to change our attitude to be one of unity, to move together as a whole, to think you will never, after this pandemic, see yourself as separate from the whole the way we did before the pandemic, as individuals that had the autonomy to do whatever we wanted. We're going to understand, and we're going to understand it from experience in the most horrible way possible, through death, through a massive amount of death that is going to gut you, that is going to break you, that is going to leave you reeling after it comes through your community. So, folks, we have to start thinking about how we do this better. I want to read some comments. Betty Davis comments, family living in Phoenix area that went to grocery shopping, needed to get supplies for 2 family cars for oil changes they needed to do, but there was no place open to get the supplies for oil changes, and grocery had limits on stuff. Yes, I'm going to be talking about that, Betty, very, very soon. Okay, we're going to talk about shutting down of services. I'm going to talk about some of the things that are happening. I'm going to tell you why they are happening. Okay, if you're going certain places and they're telling you you can't shop for certain things, or certain places have been closed to shoppers, I'm going to tell you why that's happening. Betty also tells us, or Sherry, no, is that Sherry or Betty? I can't tell. It's Sherry. I'm sorry. Sherry writes in, Texas Governor Abbott has waived renewing driver's licenses until further notice, but we occasionally listen to the scanner, and the DMV is accessible for police and other law enforcement agencies. We are using a service provided by Texas grocery store chain HEB that delivers free for seniors and the disabled. Good to know.
Nice.
Some limits on certain essential items, but not unreasonable. Last order, I got all I asked for. Great. We have that too. There are services that we want to tell you about here in the local community. The Fargo Dome has 200 beds available.
I already covered that, yes.
You did? Okay.
Yes. Mm-hmm.
The Fargo Perkins is now serving grocery items.
Yep.
Some places are turning into grocery stores, Duke.
Well, I went and looked at what they had here locally, because they had 2 options. They had curbside pickup and delivery. And I was like, I could get a Perkins pie delivered to my home, and they had a pantry where they had a lot of meats, and they had breads, and they had different supplies, and they had toilet paper. And I thought, oh my goodness, Perkins has toilet paper in their pantry. But sadly, they won't deliver the toilet paper, but they'll deliver you ham and brisket and beef and chicken and, bacon and all these other things. So it was a really good supply, a little bit more expensive than a grocery store, but a different sort of quality. So I did check that out and look at it, and I thought, that's good. That just emerged within the past couple of days.
This is an amazing radio community. I just have to say that we have an amazing radio community, both on terrestrial air locally and internationally. Over the last 10 minutes that we've been talking, I have already scheduled, while we're doing live radio, a report from Mexico City with our correspondent who's watching us right now, as well as a form of assistance to get groceries to my mother, who is stranded in Puerto Vallarta, through somebody that regularly watches our show that happens to live there.
Oh, cool.
Isn't that amazing?
Very cool.
Do you see the power of radio to help people everywhere around the globe?
Yeah.
That's why you need to get one in everybody's home. Right now, we got to get one in everybody's home.
Exactly.
Essentia Health is now saying, I got to go back to Eventide. Excuse me. Let's talk about Eventide for a second.
Okay, this is
please.
Well, I'll put myself on the screen first.
Yes.
Eventide is a senior living center that's one of the largest ones in the community. We've reported that they had a nurse practitioner from one of the healthcare places.
Sanford.
Sanford. I couldn't remember. Sanford go do her rounds with different nursing homes and then tested positive for, coronavirus. Eventide's been listed on the state of Minnesota is watching the nursing homes because nursing homes are, they're going to be hit hard. It's obvious it's going to happen, and they're trying to do so many things to prevent that. So, they put out the numbers, and Eventide's been arguing about that these numbers aren't correct because that person wasn't an employee of theirs, so therefore it shouldn't count as someone who is positive in their institution. And I thought that's a weird thing. And what they've done is they've started a marketing campaign about their nursing home, and they must have hired a marketer because they're having all sorts of media show up and people show up and all these sorts of things. And then they post things every day saying how the people working there are heroes, and of course they are. But this one came out today, and they're showing their cooking staff and other staff. And I'm looking at the people. There's no social distancing going on there. These people all go back out into the community, and they've been consistently showing pictures of people not properly gowned and not gloved, and basically, I worry that their own employees and their tactics or their policies aren't going far enough, and they're going to end up having a lot of people infected with this virus because I think they're being really sloppy. And that's my opinion because I see it every day, and I know what really needs to be done. There was another nursing home that basically fogged the whole place with something that would kill the virus, and they're taking it real seriously, and Eventide's not. And it bothers me when I see these things every day because they're doing a lot of self-promotion instead of taking the steps that need to happen to keep people out of danger.
Now, I know that you're very concerned about this because our daughter works there.
Yes.
And of course, as a parent, we're always going to be worried about the facility during a pandemic where our child is working. But they should also be thinking about the residents. They should also be thinking about all of the nursing homes. There is no preparedness plan I've heard from any person, any state at the federal, state, local level on how to ensure and protect the people in nursing homes. In other countries where this virus has already ravaged the communities, there has been tragedy after tragedy after tragedy. I don't even want to imagine the hellscape that is headed to our nursing homes if this gets out of hand. And yet, there still seems to be not enough, okay? I'm not tearing these places down. I'm saying they're not doing enough, and the consequences will be counted in numbers of bodies. And by the way, a disturbing report came out. If this is any kind of indicator of what we're going to do with our nursing homes, it's very scary. NPR reported that in Texas, in a Texas nursing home, they're making a disconcerting move, testing patients, giving them an unproven drug, which is the hydrochloroquine. And there's concern about it because
untested.
Yeah, and a doctor at this Texas nursing home started giving the anti-malarial drug to dozens of elderly patients that are diagnosed with COVID-19 and tracking the outcomes in what he is calling an observational study.
Gonna observe it. See what happens. See what happens study.
I wonder if the patients agreed to be in the study. Maybe they did. Because they've already had cases here, okay? So let me just give you a little bit more detail. Use of this drug to treat coronavirus has set up a heated debate, of course, in the Trump administration and with leading health experts over how efficient this is. As Fauci has said, it still hasn't been tested, and there's no, we have to wait for the trials, blah, blah, blah. Anyway, the president has enthusiastically been championing this drug, hydrochloroquine, calling it a game changer. But some of the nation's most respected health officials have said there's not sufficient evidence. The Food and Drug Administration has not approved the drug for treatment of COVID-19. The National Institute of Health is currently tracking clinical trials of this drug. And additionally, the University of Minnesota is undertaking a trial, and Columbia University is as well. Results are not expected for weeks or possibly even months.
Wow.
So this controversial decision to administer hydrochloroquine at the resort at Texas City over the last few days has been made by a physician, Robin Armstrong, who is the medical director of the nursing home. Quote, "It's actually going well. People are getting better," Armstrong told NPR, adding that after just a handful of days, some of the 39 patients on the medication are showing signs of improvement. But scientists argue that relying on observational, uncontrolled evidence can be misleading, and that the only way to truly prove a drug is working is through carefully controlled clinical trials. And contrary to Armstrong's assertion that hydrochloroquine has virtually no side effects, it is known to have serious negative health impacts. That is why so many in the medical community worry about prescribing it without such proof. How do you feel about this? I don't know. I mean, I guess if you thought, okay, this is a controversial move, but what if this doctor, by giving these people hydrochloroquine, saves them from dying from, because it's already, I think they have a variety of people who already have COVID in their facility.
Yeah, Raheem Williams brought this up in his show, and his point was that if you are in danger of dying from the coronavirus, why not try something that might save you? It's like, and that makes logical sense. But I'm also thinking, like, I mean, this thing has quinine in it. What about the side effects of killing you with something that you're trying to save somebody with?
Well, let me tell you how bad it is right now. Out of a total of 87 people at this resort, it's called, tested positive. 87 people tested positive. 56 of the 135 residents tested positive, as well as 31 of the staffers. And one patient has already died.
Okay.
So for them, it's like, what do you got to lose at this point?
Yeah, and it's
and they may not feel like they have any other options that are going to.
To people sign off on it, use it. Yeah. I think that if it's going to work, it might work. It might not. Use it if you're faced with dying from the virus with no treatment of any sort, and that might help. Try it, and write as many notes and have as much information as you can from that, so it can be gleaned for really rolling this out if it's going to actually help. So I wouldn't say restrict it. No one can give this drug to anybody. Under any circumstances. Like, in that situation, I would try it.
Wow. Well, this doctor is giving it to, it's a small control group. I mean, obviously it's only like 87 people, but the people who were on it were getting sicker, but were not so sick that they had to go to the hospital. So, they're turning around. These people are, they're getting better. The doctor acknowledged that some families were not aware that their relatives were put on this drug.
Yeah.
Saying that for the most part, he did consult with each of the nursing home residents' families before giving them the tablets.
Oh, okay. That's not good.
But the overwhelming majority of them are awake and alert and can actually have a conversation. And she said some suffer from middle stages dementia. In some cases, he did not discuss prescribing the tablets with anyone at all before giving it to the patients.
Okay.
So he said it is common for physicians to prescribe new medications to patients without explicit consent from the patient themselves or from family members, saying it's not required.
Yeah.
Because remember, some of the patients that the doctor chose to give this to have dementia, so they didn't have the ability to consent, and the doctor didn't ask their family members if they consented either. Mm-hmm. But of course, if the doctor saves their lives, I don't think anybody's really going to care, right?
Right.
So this is a conundrum. I don't know. How do folks feel about this? It's, by the way, excuse me, swallowed that wrong. Armstrong, the doctor, is a prominent GOP activist, and they called Republican Lieutenant Governor Dan Patrick. Patrick reached out to Texas State Senator Brian Hughes, who's also a Republican, who then knew someone on the board of New Jersey-based Amneal Pharmaceuticals that donated 1 million tablets.
Oh, okay. That's where they got it.
Nationwide, including to the state of Texas and Louisiana.
All right.
So, I mean, giving it to the people that could potentially die from it the easiest may not have been such a bad idea.
Yep.
especially if it works. Hopefully, we will find out more. I will try to keep people posted on how that goes. Moving on, let us go to the next slide here. Essential healthcare workers are encouraged to wear masks. So they're asking, they're asking their patients, anybody that comes to their facility, to bring and wear their own cloth masks for help to limit the spread of COVID-19. Don't you think it would be good for them to have some there?
Oh yeah,
Because people don't
and this is pretty
necessarily
late.
have them.
Every time I went to our clinic, there it's always masks when you came in. If you had a fever or a cold, they ask you to wear a mask. It's like they probably have a mask shortage, but this is like Johnny come lately. This just came out like the other day. I thought this should have been being done. I don't even want to go near a health clinic or a hospital at this point, and especially not to be protecting myself and others. So I think it came really late, but at least again, we're talking about Fargo, North Dakota, the people who don't think there's a problem, that are running around doing everything as normal life. And so they're finally coming, that institution finally came around. Appreciate that.
Donna Munscrief Bailey, I'm sorry if I butchered that, Donna, says that major hospitals in Amarillo, Texas and Tulsa, Oklahoma have furloughed hundreds of their workers as their hospitals are almost empty. Yep, I think a lot of hospitals may not survive the pandemic. I think that, Donna. And I think that there's a lot of evidence that shows that may be the case. Hopefully we will be able to rebuild our healthcare system. I hope that it does not collapse. Now, I want to talk about how this lockdown is making some people act like COVIDiots and also driving people a little COVID crazy. This man in West Fargo decided he would become a porch pirate and would go around stealing other people's valuables.
Packages under steps.
Yeah, packages off of their steps. So, folks, what does this teach you? You have to have a designated place to put your things.
Yep, and you got to keep watch. You watch the tracking, and as soon as it gets delivered, go get it.
Exactly.
I mean, what else are you doing?
Exactly. So what you need to do is you have to have a plan for how you get your groceries or your deliveries and have them put in a secure location that you can lock afterwards, like inside of your car, or maybe make a little box that has a code or a number. What is it called?
A lock.
A lock on it? Yeah, but a combination. Exactly. That's the word I was looking for, Duke. A combination that you can give to the delivery people and just them. So you tell them this is the combination, put it inside of the thing, and then your stuff doesn't get stolen. I think I saw something like that sold on the Sharks.
Oh, yeah.
At one point.
Yeah, I remember
They
that.
had a little box thing outside you can order. I bet they sell it on Amazon.
Yeah.
Anyway, we all need to have a plan because there are people out there that are stealing things. This guy was hanging out at a hotel.
Yeah.
Fortunately, because of cameras in neighborhoods, that's another thing you could do for security right now. Get you one of those Ring camera things or one of those, cameras around your house, especially looking at your front steps or where people would deliver things. People were able to get the license plate on this guy's car and his face. They tracked him down to a hotel. They found many of the items stolen on his person and inside of his vehicle.
Yep.
So
They caught him.
So before this happens to you, make sure you have a plan. Also, we want to share that if you go to this website, you can find the Cass County Food Resources. Cass County Food Resources can be found at z.umn.edu/Cass Clay Food Resources. That once again is Z as in zebra .umn like University of Minnesota .edu like education // Cass Clay Food Resources. And it will give you all sorts of links in this document to where you can find out where free meals and groceries are available, what food assistance there is.
Oh, nice.
Groceries, meal delivery, grocery shopping for at-risk populations, farmers with products for sale, employment opportunities right away, immediately in food and beverage, food infrastructure and volunteering, emergency funding for food systems, home food skill resources. So if you don't know how to cook, or if you need to know something else, like how do you can food or whatever, supporting local farmers, other food information, check it out at z.umn.edu/Cass Clay Food Resources. And now I want to show you what the future holds and why maybe I think a lot of people are going a little cuckoo right now.
Yeah.
It is what Dr. Fauci has said, and what a lot of experts are saying is that it's time now to have extreme, strict stay-at-home orders. And this man who is in Bloomberg.com, Kashkari, is saying that the United States may face 18 months of rolling shutdowns. He said, quote, "We could have these waves of flare-ups and controls until we actually get a therapy or a vaccine. I think we should all be focusing on an 18-month strategy for our healthcare system and our economy."
Wow.
Whether you like it or not, that may be the reality. You've been told by experts. Getting Dr. Fauci fired is not the answer.
Yeah.
I know that there's a lot of people out there that are now calling for Dr. Fauci to be fired, but Pence is saying it too. And whether or not you want to accept this reality, Trump knows his supporters. And Trump knows that his supporters are a bunch of individuals who don't like being told what to do, just like him. And so he's not going to be the one to tell you what to do. He'll have Pence do it. He'll have Fauci do it. He'll have someone else do it. But he's not going to let a bunch of people die. He's going to tell you the truth. He's going to tell you how many people could die if you didn't do something, if he didn't tell people that they needed to stay indoors and stay safe. So whether or not it's making people crazy, if you want to stay safe, you still have to do this. And right now, we can't afford to have a bunch of people, putting stress on the already stressed out medical system and first responder system. Why? Just look at what's happening around the country right now. Tornadoes just struck in Louisiana and Mississippi over the weekend, killing people and destroying at least 300 homes. Wow. This is not a time for to have a bunch of people that are unhoused. That's all happening, and this on top of the pandemic is going to be really overwhelming, especially for places that get hit hard. I also heard that in Chernobyl, there's fires that are ignited again in Chernobyl.
Really?
Yes. And in Africa, they have 2 generations of locusts that are set to descend 400 times stronger in East Africa than they were before. Truly a biblical proportion of different kinds of plagues, it seems, plaguing the earth. But folks, we need to be prepared so that we can confront these issues even in the middle of what is happening. Now, here in the U.S., that also represents the fact that we're going to have food shortages.
Yeah.
I think that you're already starting to see that because farmers are throwing things away. I think it's not a good idea for them to do that. I think we should be taking everything in and making commodity cheese and powdered milk and, remember how they used to do that?
Oh, yeah, yeah.
And stock it, USDA, come on. Let's go. Let's stock all this stuff and give it to people later on or whenever they need it because there's going to be food shortages. And because people that are working in the food chain that are, important essential workers are still out there working, they're going to get sick like they did in this giant plant, one of the biggest plants, the Smithfield and the pork plant in South Dakota, where they had 293 people in that plant that have been diagnosed with COVID-19. So they had to close it.
Yep.
The announcement came a day after Governor Kristi Noem and Sioux Falls Mayor. Can you finish reading that?
Sioux Falls Mayor Paul Tenhaken wrote to Smithfield and urged the company to suspend operations for just 2 weeks. And the next day they closed it permanently because they had so many cases, 293 people who tested positive. And this also moved the numbers, skyrocketed the numbers in South Dakota for their positive cases of COVID-19.
Yeah. Well, let me just tell you something. That number accounts for almost half of the numbers in their state.
Yeah.
So, yeah, it's a problem. And I think, South Dakota is one of the states that hasn't really or didn't put a stay-at-home order in place.
Yeah.
So we're going to see these tragedies occurring in places like that.
Mm-hmm.
Did we go over meat plant closing 1 and 2?
Yeah, they're all done.
And then let's move to the wastewater article where I was telling folks that coronavirus has been traced in Massachusetts wastewater at levels higher than expected. This could potentially indicate the number of confirmed cases in the area served by the wastewater treatment plant. So what does that mean, higher than they expected? Well, for the latest study, a team involving scientists from startups Biotech Analytics, the Massachusetts Institute of Technology, MIT, Harvard University, and Brigham and Women's Hospital tested water at major urban treatment facilities serving a large area of Massachusetts in the period from March 18th through March 25th, finding higher quantities of the novel coronavirus known as SARS-CoV-2 than predicted, according to the study published at the preprint server MedRZib. Quote, at BioBot, we have been using wastewater-based epidemiology to generate data on the opioid crisis in the United States, Eric Alm, one of the authors of the study, told Newsweek. At my academic laboratory at MIT and also in Singapore, we've been developing wastewater-based epidemiology to estimate disease prevalence of typhoid in Nepal and dengue in Singapore. During the study period, the authors of the preprint say that there was nearly 450 confirmed cases of COVID-19 in the area served by the water treatment facility. But the latest results suggest that this figure could be an underestimate, although more research is needed to verify this. While the team currently lack the data to provide an accurate figure for the number of people actually infected in the area, they estimate that it could be anywhere from between 2,300 and 115,000, far higher than the official figure in both cases. And if Massachusetts is a microcosm of everywhere else in the country and the world, especially in this country where we have not enough testing, then there probably is a much higher number of people that are actually infected.
Yeah.
Your thoughts, Duke?
Well, I think that I hadn't thought of that. Didn't know that was even going on. But I think that every available way of doing testing to really show that the numbers are higher, because just the whole issue of testing, not everyone needs to be tested. There's these sort of arguments are going on, but the numbers are growing. So anything that can be done, from different methods to really get a feel for what's really going on with the more positive cases that are out there, I think leads us in the right direction, because ignoring the stuff isn't going to change the outcome. And I think a lot of things are happening that people feel like, whoo, it's over now, or we've hit the plateau. It's all going to go down now. We'll be fine by May 1st and open up the whole country again. It's very naive thinking, because you just look at the other things that you can look at. You look at the actual data, and it's just not going to happen that way. It's giving people false hope again, and that I don't like that. So anything we can look at that helps shore up that this is serious and we need to continue to stay in place and not encounter other people is the way we're going to beat this.
Exactly. Now, I want to bring you some information from a doctor named Craig Spencer, who is, by the way, Ebola survivor, a New York City emergency room doctor, the director of global health and emergency medicine at Columbia Med, and he teaches public health at Columbia medical something. It's abbreviated. He's also part of the MSF USA board. And here's what he's telling us about what's really going on in New York hospitals. And of course, I think that this could be extrapolated onto the fears and expectations that we have for people getting treated in the United States for COVID-19, which are you going to actually get treated? Are you going to get turned away? Maybe because you don't have insurance. What actually happens if you have mild symptoms? Are you going to get turned away? What constitutes mild symptoms? Dr. Craig is going to answer a lot of those questions in this thread I'm about to read to you. Hopefully this helps. So he says, what's really going on here in New York City? You're hearing conflicting information on who's tested, who's admitted, who goes home, what's going on inside the hospitals. Let me shed some light. New York City ER docs are a small and collaborative community, so let me share the scoop. First and foremost, anyone and everyone who is sick and presenting to our ERs is evaluated. Our work in the ER is still subject to the Emergency Medical Treatment and Labor Act. That means every patient gets a medical screening, exam, and stabilization. Always, no exceptions. Also, to reduce the risk of providers and patients, many hospitals have drastically increased telemedicine capacity. This allows patients to talk to a provider virtually, no exposure for the provider or the patient. On those calls, we can often tell who needs to go to the ER and who does not. Testing, who's getting it? Almost invariably, the only people getting tested are patients that are being admitted into the hospital and being hospitalized. Why does that matter? Because the hospitals are sending home probable cases every day without any confirmation through testing. They just don't have the capacity to do that right now. There's 93,000, approximately, there's over 100,000 cases now. This was written on April 10th, folks. There's 93,000 confirmed cases in New York, but the number is likely much higher. This is frustrating for symptomatic patients who want tests but can't get them in the ER. At this point, we assume if you're having symptoms of COVID, you have COVID. A test doesn't change anything. Hospitalization, who's getting it? There is no way that we could admit all the COVID patients to hospitals. Thankfully, we don't need to. Most hospitals have a protocol, even for probable and or confirmed COVID patients. If your oxygen saturation is above a certain threshold, you go home. That means that some patients with oxygen levels as low as 94% or even lower and still walking end up being sent home. And that, right now, during the pandemic, is 100% normal. Is that different than pre-pandemic, what it used to be normal practice? Absolutely. Hospitals are sending home patients today that they would have almost certainly admitted and hospitalized just weeks ago. So why is this the case? Because we need to preserve space and staff, which are in short supply, for only the sickest patients. Each severe COVID patient takes a lot of staff. For one person that's severely ill, because if you're going to have to be hospitalized, you're in critical condition. You need hospitalization. That's the only people that are getting hospitalized now. And every one of those people requires a whole team of people to take care of them. Did you hear Boris Johnson just recovered from the COVID and got out of the hospital?
Yep.
He took a large portion of his television broadcast in which he was telling people his condition and how he was going to return to work, to thank the doctors. He named specific staff members that cared for him, and specifically the two nurses that were at his side for 48 hours continually. You think that our hospitals in America have enough staff to give you two personalized nurses just for you around the clock?
No.
I highly doubt that. I think that only happens for people maybe that are prime ministers or other important people. So what this doctor is saying is incredibly important, because you have to think of how many people it takes to help one person. Okay? To be very clear, each severe COVID patient takes a lot of staff and a lot of time. And many hospitals are already at capacity. So to be really super crystal clear, really, really sick patients are not being sent home anywhere in the country. Full stop. What about mildly sick patients? What happens if you send one of them home and then they get worse? Well, then this happens. Hospitals provide follow-up. They make phone calls. They do telemedicine visits. And some provide pulse oximeters to test oxygen levels. And some provide oxygen concentrators with education on how to use them. And then the goal is to keep all of those really sick patients in the hospital. Everyone that needs hospitalization gets hospitalization everywhere, all throughout New York City. But a lot of people are sick and they don't need hospitalization yet. Some with low oxygen, some with pneumonia-like symptoms and nasty chest x-rays. The bottom line is that anyone who should be admitted is admitted. As we plateau or start to decline, hospital admission policies may change. So in summary, everyone is getting evaluated. Not everyone is getting tested. Everyone who needs to be admitted is admitted. Life support. Who's getting it? For many patients, mechanical ventilators, life support is the only thing that saves their lives. Let's be clear. This is not a service that is being rationed. With an increase in ventilator supply, we're in a less precarious position than even a week ago. But if you need to be intubated, put on life support, and that is your desire, you fill out your medical directives, people. If you don't have a medical directive that you have written out that is on file right now that says if you end up in a situation where you cannot breathe on your own, you want to be kept on life support and intubated, then you need to do that now, because if you don't have a medical directive that says that's what you want them to do, they can choose for you. They will choose for you. And during a pandemic, when there is a short supply, that choice may be, oh, I guess this person didn't want to be intubated and put on life support.
Wow.
So fill out your medical directives right now. Okay? Did you have something to say?
You're listening to KPPP LP 88.1 Fargo Moorhead, adding local color to your airwaves.
This show is jam-packed full of information you need to know to survive the pandemic, folks. So, however, we're finding that many people put on ventilators have very, very little chance of coming off of them. That means that many ERs are involving palliative care service early to talk about goals of care. What would this patient really want? This is something we're not used to in the ER. We're trained to save lives, not plan how to peacefully help withdraw care. And I cannot stress this enough. Please, please, please take time to think about what you would want if you ever got really sick. Who would make those decisions for you if you weren't able to? What would you want to be put on a breathing tube, a ventilator? Would you want to have chest compressions? These are the hard and difficult decisions that you need to make right now. But trust me, despite how hard it is to have this discussion when you're healthy, it is much, much harder to have it when you or your loved one is really sick in an ER and struggling for their life. If you need a ventilator, you will get a ventilator. But remember all the other things about the directive and having those talks. One important thing to recognize right now is that COVID is hitting hard at different spots all around New York City. One hospital might be fine, while another one a few miles away might be inundated. This virus is exposing the deep structural inequality inherent in our city and throughout our country. COVID hits harder in our outer boroughs where New Yorkers without the same financial ability to stay at home and socially distance live. This cannot be overemphasized. Just look at the maps. The result is that COVID has a much greater impact on Hispanic and Latino and Black and African communities in New York City. This cannot be overemphasized. Look at the charts. If you made it this far, hopefully you've got a better understanding of what's happening with COVID in New York City, who's getting tested, who's being hospitalized, who's going home, and what's happening inside the hospitals. But I hope you also take away this important message of what's happening outside our hospitals in our New York City community. Let's commit now to addressing the reason why this virus is having an outsized impact on marginalized population in New York City now and when COVID is no more. Good advice from Dr. Craig Spencer, MD. Thank you for that advice, Doctor. I want to share with you what people have been posting about that is going on in shopping malls in several states all over the country, not just in Walmarts, although this is a Walmart, but also in Costco's and Targets and other stores. Check out this video of one shopper very, very angry.
So this is what it looks like when the government starts taking all your rights away. You can't even do your housework when you're quarantined. You can't even buy leaf bags to pick up your leaves to clean up your own yard while you're on quarantine. This is a perfect example of the government taking away our rights every day. It's time for America to wake up. This is not acceptable. This is against the law. This is not right. This is against our laws. We have constitutional rights to be able to buy this stuff and do our work. And they're refusing to let us buy even seeds to plant our own vegetables. We can't even buy seeds to plant our own vegetables. What are we going to do when the stores close down and we can't go to the stores to buy vegetables? Oh, that's right. We can't even farm our own stuff. Congratulations, America. This is the beginning. We're going to be screwed. Can't even buy the stuff to take care of your own yard while you're on quarantine. Look.
Now, I get that this man has a really important point, especially with the gardening stuff, because we do know there are going to be food shortages. We're already seeing evidence of that. And there's going to be a recession, maybe even a depression for a while economically in this country after this pandemic and throughout the world. So seeds are very important. And I know that everyone is thinking about how they're going to sustain food in their communities. However, one of the problems that this is not discussing is the actions of a few are affecting the whole. And that those actions are a lot of folks who, out of boredom, are going out shopping. It's one of the few things you can legally do under the pandemic in these states, in many states now in the United States, where you're being told to shelter in place, where you're being asked not to go out unless it's critical. And some people who think they're smarticles are like, I know a way around this. I'm going to figure out how I can go out, because they're literally going stir crazy right now. Yeah. And they can't figure out what they can do. They're trying to find a loophole, right? Mm-hmm. Like they're little toddlers. They're trying to figure out a way around the laws, and they're going shopping. And what are they doing? They're not shopping for essentials like food and fuel and medicine. They're going, they're window shopping and all the other aisles, and they're I guess they're deciding that they're going to redecorate their home during the pandemic or start some kind of project in their house. Mm-hmm. And that is causing more people, especially in places where they're reducing the number of the people that can go in and shop at a time. Mm-hmm. It's causing problems for people that need to go shopping to actually get their resources.
Exactly.
For them to be able to get them. And then also is causing, in places that don't have restrictions, overcrowding in the stores, which puts people in more danger of having the virus spread. So what's really going on, we researched this, is that Walmart's, Costco's, and Targets all around the country are being barred by law. They're not choosing to do this. They're being told they can't do this. They're barred from selling non-essential items, such as clothing and electronics, in different parts of the United States. Big box stores and grocery chains in certain areas of the U.S. are now being asked to, cordon off certain parts of their store where non-essential items are being sold to reduce the foot traffic and prevent the spread of COVID-19. Certain local governments have directed those stores to empty areas with non-essential items, such as clothing, electronics, or to rope off items to prevent customers from buying those items. Some shoppers have applauded this new restriction and encourage other local governments to implement these laws. But Vermont is one of the states in which the clampdown is happening. And a lot of people are just really ticked off. At the end of March, the state's Agency of Commerce and Community Development directed essential big box stores, including Walmart, Costco, and Target, to stop selling non-essentials. In the government's executive order outlining what essential services are. Large big box retailers generate significant shopping traffic by virtue of their size and the variety of goods that they offer at a single location. That's part of the problem, folks, these big box retailers. Because this is what Lindsay Curl, the secretary of the agency, said in a statement. The volume of shopping traffic significantly increases the risk of further spread of this dangerous virus to Vermonters and the viability of Vermont's healthcare system. We are directing the stores to not put the public health at risk and to help us reduce the number of shoppers. So they did. And that's what's really going on. I think you can still get seeds at other places. I think you can order seeds from other places, Duke, right? If you need to buy plants.
It's kind of hard. It's kind of hard, actually.
Really?
Yeah. It's Gurney seeds they won't send them out till they're supposed to be put in the ground, so they're still viable. But I had trouble getting seeds. I've actually have some coming this Saturday, but Amazon has also done the only essential. You order something from Amazon, and it's not going to come very fast. It used to come like in a day. You'd have it, that sort of thing. They're focusing on what they call essential items too, so your stuff isn't going to be shipped. And I thought seeds and gardening stuff was essential, but it's like it's taken a while. My stuff's like a week, 2 weeks, but it's still coming. It hasn't been canceled. So it's like that also deals with how do you transport stuff and shipping. Shipping is kind of hard right now because it's being inundated, and because people are needing things shipped because they're not going out to buy them anymore. So it's a little bit slower, but you can get seeds. But the local stores, like Target, won't deliver you seeds, even though they have them out there. They just won't make them available for delivery. Because I looked.
I would look in different places. Okay, I get why people are mad about this. I would go to the hardware store, go find the mom and pop shops in your town that are still open. Mm-hmm. Find the co-ops, find the farmers. Find the seed sharing nurseries. And saving. Find the nurseries.
Nurseries are still open.
Find the seed sharing and saving groups in your local community.
Yep.
So that you can swap and I just saw a bunch of people talking online swapping seeds. Mm-hmm. I've got some of these seeds. We have several different heirloom pumpkin and different kinds of seeds that we have a surplus of that we're going to use to swap for other seeds that we want in our community. So. If you're looking for those kinds of things for growing a garden, that's a good place to start. Now, here's another tip. You can also forage locally for different kinds of foods. One of the people that saw this post from the Heirloom Gardener about how hosta shoots, especially when they're little babies, when they're just coming up, are basically a cross between a leek and asparagus, and they're perfect for pan frying with a little butter in them. So there's a lot of different perennial gardens that have tasty edibles that you can find right in your yard or nearby in your community.
And we have 2 of those in our front yard.
We do.
Waiting for them to come out of the ground so I can eat them.
Yes, we're going to forage in our community and in our gardens. And dandelion flowers was one of the recipes that one of our listeners and viewers recommended to me. There's a whole bunch of things we're going to be trying, I guess, this summer. And spring. So send in your recommendations for foraging, for seed swapping, and for local growth of food, production of food. Here's one of the signs that was posted in one of the Walmarts. You want to read that for me, Duke?
Yeah, if I can. It says, attention customers. By order from the state of Vermont, items in this non-essential area are not available for purchase. Please use Walmart.com for your needs until further notice. Thank you for your understanding. We apologize for any inconvenience this may have caused. And this is right in front of the garden seeds.
Yeah, it's right in front of the garden seeds, cordoned off that area.
Oh, man.
Also, you could petition your local government in the states where this is happening and have them remove gardening items and seeds from that list.
Yeah.
You know, like dirt. You need dirt, you need fertilizer, and you need seeds.
Yep.
And
Might need a shovel and a rake.
but I mean, essentially, you know, the basics. Petition your governors to have those put on the list of essential items that you need to shop for, so that your local government knows that that's what you need. Also, many people that are going crazy during this lockdown have decided they would join a group of protesters that are protesting all over the place. If you could go to these images, we have some images from one of these many protests that took place across the country. What's really crazy is that normally I would expect a lot of liberal Antifa type people to be out putting their lives and the lives of others at risk by not quarantining. But it's happening equally on conservatives and liberals out there now.
So they're complaining about having to stay inside? Is that what this is about?
Yeah.
Well, that's crazy.
Yeah. No, well, they're saying it's not just that. It's, the fact that their rights aren't being, they're in front of the...
You don't have the right to tell me I have to stay at home.
Yes, that their rights to protest, their rights to assemble. There's a guy with a horn. He's blowing a horn, a shofar.
Tooting his own horn.
He's blowing a shofar. That's like the Jewish call to the people to unite.
Okay.
And people there were very much talking about how they could not believe that their rights were being infringed upon. They have constitutional rights. They have, I don't think that a lot of the folks that are talking about their rights and under the law really understand the law as well as they think they do.
Yeah.
But let me just say that these types of lockdowns are marches that are going on all around the country. They're called No More Lockdown Marches, and they're being announced all over the world on April 12th, which just happened yesterday. And I think there's going to be a lot of sick people because if at any of these places that you saw, people weren't even wearing masks. They weren't social distancing. If one of those people was sick and it got spread, there's going to be a lot of people in those groups that decided to organize and march that are going to end up critically ill. And the bottom line is, when you go out and do this, you put the whole healthcare system at risk.
Yeah.
You don't have the right to collapse the whole healthcare system of the entire state and literally put people out of business because you didn't want to follow the rules that would protect everyone else. You have to function as a unit right now. Let me show you this Charlotte woman. If you think that the risk is too exaggerated, let me share the story with you. This Charlotte woman hasn't even left her house in the last 3 weeks, but is tested positive for COVID. And you might be asking yourself, how in the heck did she get it if she hasn't been around anyone? Well, she does live with her husband, who's temporarily living in a separate room, and he's the one that goes and gets the groceries. She has a immunocompromised system, so that's one of the reasons for quarantining, because she's very scared of getting this virus. But now she's got the virus, and she said she barely didn't have any contact with anyone except for the person that volunteered to drop off groceries at her doorstep once, whom she spoke with. They didn't touch, though. They only spoke to each other, and later that woman that dropped off her food tested positive. So, she also picks up her mail every few days. She's not sure if she got it from one of the packages. She didn't wear gloves when she brought in her packages. Maybe she didn't properly clean them. But folks, that's all it takes. That's how easy it is for you to get COVID-19. And in a case like hers, it could be deadly. So here's why you have to function like a unit. You got to go in the other direction.
I know.
Right there it is. Function as a unit. And this is an opinion that was written in our local newspaper. by Mr. Shaw. It's not hype, it's life or death. And I guess he quoted Dr. Paul Carson, a Yale epidemiologist, who wrote, "People will die that didn't have to. You should perceive your entire family to function as a single unit. If one person puts themselves at risk, everyone in the unit is put at risk." So, folks, you need to think of things that way. Is there some person that you're living with? Maybe it's a roommate, maybe it's your spouse, maybe it's one of your kids that feels invincible, that's going on, lockdown lunacy mode, and they feel like they got to go be a marathon runner every day, and they got to go shopping every 5 minutes, and they got to get out and they got to social distance while seeing their friends. They're putting you at risk and everyone else in your home at risk under quarantine. So you need to have a hard conversation. I've talked to several people, even within my whole family, that had to come to terms with the fact that those people who are putting the rest of the unit at risk need to go on their own. And maybe that's what has to happen. Maybe that's what has to happen in this situation. That person that is putting everyone else at risk needs to leave. But you have to think about that and act now before someone or everyone in your home is sick. Now, let's talk about another thing that is driving people cuckoo during this lockdown, and that is their internet jamming up. Would you know about that, Duke?
Oh, yeah. This is something that's bound to happen. It's so many different factors. And, so, they're going to give you all sorts of advice that your internet gets slow. And the thing is that a lot of the issues actually aren't the internet provider's problem. It's really yours inside your home. So you have to get more savvy. Like I said, the cable installers for internet are going to come and give you a kit, and you have to put it in yourself. You're going to do things like reboot your router. You do that periodically because it's basically a computer, and it gets slow after it's run for a while. You also have to be thinking about you're using cable, which has really good download, but not that great of upload because it's coaxial cable. So if you're doing a Zoom meeting or you're streaming like we are right now, and you have somebody else trying to do the same thing in your household using the same internet bandwidth that you have, it's going to clog up a bit. So get other people not to be streaming heavy things. They can watch Netflix and those sorts of things. It's not going to slow it down that much. But if there's a heavy duty stuff going on, you have to basically kind of monitor your bandwidth when you want it to be at its maximum. And you can also look at your internet providers, web pages, and they'll give you a speed monitor, and you can test it. You can see, is my internet really slow, or is it just slow because we're clogging it up here at home? So I'd suggest doing those things and do all that before you buy a better package. The idea is that you don't need to spend more money for something that actually, gives you a lot more bandwidth, but it was unnecessary. Now is the time not to be frivolous and spending more money. So that would be my advice.
Exactly, Duke. Thank you very much for that. Thank you very much for that advice, Duke. I also want to point out that Trump is mentioning that during press conference recently, Trump said that doctors that are complaining you just went past it. Doctors that are complaining may just want to get on TV. And the press conference that he said this at, he was talking about how these doctors might just be looking for attention, I guess.
Yeah.
And I don't know. I don't know if doctors are looking for attention when they say that they don't have enough equipment. This is something that isn't just happening here in the United States. People are asking for equipment during a pandemic, which they think they will have to need, that they're going to need. I think that that is about the firing of Dr. Fauci. And the other one is different. See, that one's the one that is the Trump suggesting doctors complain about the lack of coronavirus equipment. He said the U.S. becomes the first country to record more than 2,000 people dying from coronavirus in one day. It's possible that there are some doctors. I'm not going to deny the fact that there could be medical workers that are trying to crucify this administration or some state government or some leader in the world and blame them for the lack of PPE or the way that the hospital is administering things. But the reality is that during a pandemic, people are panicking, but they also want someone to blame. They want something to focus on to say, okay, this is where the problem is. Whose fault is it, and how do we fix it? And I guess the reason why I guess it's important for folks to try to figure out whose fault something is so that you don't repeat the same thing. But in this instance, I don't think that Trump is actually suggesting that doctors don't need things. I think that he's suggesting that we have to look at things more carefully in order to find out whether what people projected that they were going to need is what they actually need, so that we can best administer. So we don't send extra things to New York when New Jersey and Massachusetts and other states might have a shortage, or Louisiana might need them. You know what I mean?
Yep.
Also, there's a story in the Daily Beast about how Deanne Lorraine, you remember who she is? That was the ex-girlfriend of Omar Navarro that sent him to jail because he broke a restraining order against him and was stalking her. Well, she tweeted to the world that it was time to fire Fauci after he went on, I can't remember what news station, it might have been CNN, I think, and he was asked repeatedly, I saw this interview, where he was asked repeatedly whether he thought that the president didn't act soon enough, and that if he and his whole task force, including the Trump administration, could have saved more lives if they had acted sooner. And he got asked the same question 3 different ways, and finally he got frustrated. You could tell he was frustrated when he answered the question, and he was like, sure, okay, I guess, obviously, if you could go back in time, maybe. I can't tell because it didn't happen that way, but, and I'm paraphrasing here, but he said, what does that matter now? What does it matter whether or not you could go back in time and have started the process that we're under now sooner, when we can't do that anymore because we're in the present? So all of a sudden, his response to that was spun as a rebuke of the president and throwing the president under the bus and saying that the president killed a bunch of people, a bunch of innocent people died because of the president not acting, and the task force and Fauci not acting soon enough. That's not how the interview went. I watched it. That's not what happened. Fauci is saying to this reporter, and I'm sure to all the reporters that have been asking, because I've been watching the press conferences, yeah, we can't rewrite history. We don't know exactly how things would have gone if we would have acted differently because we can't go back in time. But the point is not to focus on the past, but to focus on what we're doing now.
Yep.
So for all of you out there yelling, fire Fauci, I think it's a dumb move. Don't ask the president to fire someone that a lot of the people in this country are looking to for some kind of comfort and solace from a medical expert. And if you keep switching people every other week that you don't like how they're talking to you, that's only going to make people feel more unstable. And it's only going to make this lockdown last longer.
Yeah,
so
exactly.
Calm yourselves down, people.
Exactly.
Please. Jerry Nochi mentions that you can cook stinging nettles and eat it like spinach.
Oh, really?
I guess so. We'll have more, I'm sure, people writing in to tell us.
Yeah,
Now, I want to tell you what the con artivists, the COVIDiots that are out there, con activism, and part of it is that they are doing these rallies, car rallies I showed you. The latest one is set up by Pueblos Sin Fronteras, and I told you they were the ringleaders on this. The immigrant defense twatter just tweeted that Pueblos Sin Fronteras organized this rally outside of Otay Mesa detention facility, showing support for the people inside. And they say that there was unrest inside the facility that allegedly led to pepper spray being used on women who did not sign off on an English-only indemnification form to receive masks. So they were asked to sign a paper in order to get masks to cover their face to protect them from COVID. They refused to sign, a group of people refused to sign them because they couldn't understand what was written in English. But I'm sure they could see masks were being provided, couldn't they? You would think, right?
I guess so.
Who knows? But my point is, they didn't want to sign a paper because it was in English only in order to get masks in a detention facility. How dumb is that?
Yeah.
Why not take the mask? I would take the mask if they offered me a mask in the detention facility and you refuse to take the mask and then you start to protest or riot and they end up having to use tear gas on you, then maybe you shouldn't have done that. I mean, I told you there's a lot of these riots that are being organized from the outside in order to get the authorities to release everyone, because ultimately what their goal is to have all of the detention facilities, and for that matter, all of the prisons, open their doors and let everybody out. And I'm here to tell you, whatever your opinion is about whether or not it is cruel to keep them inside or to let them go or to let the ones that are less dangerous out or to let the ones that are higher risk out, whatever your criteria in your mind for your fantasy wish list of the people that should get out of these facilities, the likely answer is going to be no. Where are they going to go? I just need to ask people that.
Yeah.
For all of the people dreaming of this utopian situation where all of the people in all the prisons are set free, where are they going to go? Are you going to put them up at your house? Are you going to break the quarantine at your house to let them in? I don't know of who's going to take them in. And what kind of government response, and why is the government going to focus on responding to that first and foremost? What they're required to do in any prison setting is to give the people inside whatever proper sanitary, proper medical that they can provide for them as wards of the state. And if they're offering them masks, they should probably take the masks and put them on. Period. Anyway, here's a video of these COVIDiots doing their car rally. Just a bunch of noise. Just honking outside of this giant facility with this massive wall with like reinforced cement. There's no way anybody in that building can ever hear any of that. It's just them outside.
Useless protest.
It's completely useless. And I don't know how Bernie's going to, how Biden is going to feel about this, but feel the burn they will, because the Democratic Socialists of America are not endorsing Joe Biden.
Oh, boy.
Wah, wah, wah. This is going to be awkward for the Democrats. Yeah, but Biden is a Democrat and Bernie is a socialist. And that's all he's ever been. And the socialists of America are not going to support the Democratic Party. They're trying to destroy the Democratic Party. But I already told you that. And here, now that Bernie is out of the race, people are going under the bus. I can't wait for this to implode. Jeremy White, one of the surrogates for the Bernie campaign, is throwing Tanya Sin under the bus. If anybody knows the story behind Tanya Sin, hit me up.
Yeah.
Get in my DMs. I want to know more about who he calls a serial movement grifter. Mm-hmm. There's so many of them. And her fake GoFundMe accounts that have been taken down by serious activists who were sick of her taking advantage of us the entire time. This is a big win. Yeah. Really, Big Mouth? Yeah. How come it took you until after the campaign was done to talk about her if you knew that she was a serial movement grifter, if you knew that she was a con artist, if you knew that she was putting out fake GoFundMes? and that you knew that she was taking advantage of all of the people. There were so many people in this thread. I don't have time to show you or bore you, but the fact of the matter is you knew they were dirty. You knew the whole time they were dirty. You're dirty, and you didn't say anything about it because you all protect each other. Anyway, these con artists are coming out of the woodwork, including Vanessa Dundon, who is now mocking people who are Christians that are going to church that are getting blowback for not social distancing, saying, why people getting arrested for congregating and practicing their religion, natives, haha, first time. It's the meme of the guy getting hung at the gallows. And she's also started a fund. Could you please send her money, because she's begun the Susie Desba Elders and Kids COVID-19 relief efforts.
Yeah.
A lot of Navajo people have contracted the virus now. The virus is spreading like wildfire. No thanks to people like her that don't know how to social distance properly and that are going out and not following the stay-at-home orders. And I want to tell you why these people pushing mutual aid under the Antifa umbrella, which means no transparency. You could have a child molester, a fraudster, a con artist come in to deliver your food or whatever it is, because that's who they use in their border support network. And now they've set up a COVID support network with mutual aids. Here's Johnny Dangers, who was involved all the way back at Standing Rock days. And they're sharing the coronavirus updates, information, support, and mutual aid page. And of course, they're telling people that there's a native elder program. Give to the donation thing. 720 elders need to get food. If I knew that there weren't fraudsters running these things, I think they would be great things. I would promote them on my station. But the fact of the matter is, I see them putting time and time again criminals, grifters, people that are rapists, people, and I've showed them to you. I brought you the evidence of the fact that these people are trying to rebrand themselves as hero when they are not, when they are liars, when they put people in danger. Susie can't even take care of her own kids. When have you ever seen a picture of Susie's kids? Did you even know Susie has 4 kids?
Wow.
She's got kids. During Standing Rock, did you ever see her kids? Did you ever even hear her talk about her kids? No, because she's out there trying to be a neighborhood mutual aid hero, just like all of these con artists from the Border Support Network. Here's her latest poster. Be a neighborhood hero. Look to join mutual aid groups in your area. Mutual aid is a voluntary reciprocal exchange of resources and services for mutual aid benefit. You know what I know these people are good at? Asking for donations and keeping them for their friends, keeping them for themselves, keeping them for the grifters, for the liars, for the cheaters, for the defrauders. That's what they're really, really good at. So I'd be very careful in who you give your money to and who you support. Mutual aid organizations that are filled with Antifa leadership, of grifters that I've seen that have taken people's resources in disaster-related situations in the past are not your best bet. In Baja California, they have closed a company, an American company, Smith's Medical, that was an essential service that was making emergency medical machines, including ventilators, because they refused to sell them to any of the people of Baja California. So Jaime Bonilla, the Congress member or senator for the state of Baja California, ordered the plant closed, saying, we said to them, if you want us to consider you essential, then you have to provide some benefits to the people of Baja California by selling us ventilators because we need them, Bonilla said. They said, no, we are not going to sell you anything. We are just going to continue to use your labor. So Bonilla accused the company of contacting Mexico's Foreign Relations Secretary and the U.S. Ambassador to try to stave off the closure order, but he vowed not to cave to the pressure. What do you think of that, Duke? Was it right? Was it correct of them to do? He's just trying to look out for Baja California residents and Mexico, just like our president is trying to look out for the United States and our citizens, which is why different shipments of masks and things that were designated for other countries were stopped by our country from leaving.
Yeah,
So
I don't know. It's a tough one because, we do need to, really take care of our own community. But that, again, all the things that have happened in Mexico with the United States building companies in Mexico, exploiting the workers, and not giving Mexico any of the benefit of their own resources and people. We've painted ourselves into a corner by doing that. And a lot of the stuff is catching up with us when we actually try to do things specifically for ourselves because our interests have been spread all over the place for the corporate greed of the companies who are benefiting, not the actual people.
And we don't have a lot of that manufacturing available right here in our country.
Exactly.
So how would we make it in the first place?
And what do they call it? Shooting yourself in the foot.
Well, you can't, I think, in my opinion, personally, you can't close the place down. You need to have it open producing because we need the production of these things, regardless of where they're being produced.
Yeah, the world needs them.
And I think the senator may be overstepping a little. I'm just saying.
Mm-hmm.
I'm a Mexican crossing lines, so I'm here to tell you. I think he may be overstepping a little bit because, come on, I mean, he could have gone through the proper channels himself and asked the president to ask our president, which he's already done, for assistance. The President AMLO and President Trump have a good relationship. All he had to do was, hit him up and say, hey, we got a company here that's making ventilators. Could you ask the president to make sure that we get some of them? Or can he send them from the United States? Because Baja California needs them right now. But, that's just my 2 cents.
Yeah.
Meanwhile, Mexico's people, not taking this whole pandemic thing seriously at all yet, are still going on vacation, especially during the Easter weekend. And this is a couple that was really peeved that the roads to get to the beach were closed. And she said, this woman is so angry. If you could see her right now, she has got this scowl on her face and standing there in her swimming suit. And it's just so funny to me because it's like she might as well have been in a birthday party suit with a scowl on her face.
Yeah.
Because she couldn't go to the beach. And this is what she said. You look very angry, ma'am. Yeah, I don't agree with what they're doing. You want to risk your life? And she starts nodding her head. Yes. Yeah, you got to die. You're going to die from something. And he says, yeah, something. You're going to die of something. I guess today is the day we want to go.
Yeah, instead of...
and carpe diem, carpe mortem, carpe mortem, seize the death instead of seize the day. Who cares about living a long life when you could just, choose your death, right?
Yeah, exactly.
Well, we do have a Mexican saying that those who savor everything, including death, enjoy dying. Meanwhile, in Mexico's medical community, Mexican nurses, doctors, anyone wearing scrubs that does any kind of work in facilities that care for people who are residents of nursing homes or patients at clinics are getting attacked physically and otherwise, even on social media, as you can see in this Imagen report, where they've highlighted a portion of a post saying that this is important information. Any nurses or doctors who are who are carriers or wearing carriers of the Chinese pestilence, in parentheses, coronavirus. They're calling it the Chinese pestilence, the Chinese plague. In Mexico, they call it the Chinese plague. How's that for not PC?
Yeah.
That's what they're calling it too. Mm-hmm. It's horrible. It's horrible. I think it's horrible. Anyway, this is what they said. If they are convirtiendo directamente con los que portan ya que están, since they are choosing to be directly next to those who are carriers of the Chinese plague, if you're a chauffeur, avoid picking them up, these doctors and these nurses, or people that work at hospital. avoid these people at your businesses. Throw them off of the subway. F them up and F them up if they get on a bus or any other form of public transportation.
Wow.
That is what they're telling people to do. How horrifying is that?
Yeah.
Being a medical worker, a person that has to wear scrubs or anything like that, and having the whole community turn against you, such that you can't get in an Uber, taxis won't pick you up, they won't stop for you, they're going to throw you off public transport, accost you in public, hurt you. Many hospitals now and different facilities that wear scrubs are having their personnel change before they leave.
Yeah, like they're targeted.
Because they're targeted. This is very, very sad, folks, and it's not just happening in Mexico. It's happening in the U.S. It's happened in other places. It's horrible. We need to spread the word. This is not the way to handle it, okay? Finally, here, I want to show you what's happening at the southern border of Mexico. You won't believe it. This is on the border in Guatemala. What you see before you is a line of vigilante border protectors. These are border protectors that are vigilantes. They're made up of authorities from the military of Guatemala, as well as the local authorities from the police department of San Marcos, and regular people that live in the border towns of the ports of entry to Guatemala. And the reason is that over the weekend, Mexico tossed 200 migrants from Central America, Guatemala, and other places south of Mexico over the border and just dropped them off and left them there.
Huh.
They're like, see ya, wouldn't want to be ya.
Wow.
And just tossed them over the border. And the authorities in Guatemala were furious because, and so were the people, because they fear that those migrants are carrying COVID.
Mm-hmm.
And they very well may be, because the United States is doing the very same thing. They've done to over 11,000 people that have come in since the March 20 order, that you cannot gain asylum, request asylum. You're just going to be turned out and turned back. Same thing now is happening to those that are tossed over the border in Guatemala. They don't want them there, and they have permanent vigilantes there to protect their border, so you can't toss them back into the country. I think it's going to get ugly in Mexico, folks.
Yeah.
Well, I wanted to give you a recommendation for those of you who are feeling the lockdown lunacy. The Forest Service recommends that you hug a tree if you can't hug others.
Yeah.
Yes, they do. They believe that hugging trees can give you all sorts of fun feelings. I'm running out of time, so I won't show you the other pictures of the tree huggers. Some of people were actually sitting in the trees. There was a variety of pictures in this article of people engaging in tree hugging during the pandemic for their own health. And they say that you feel it at the roots, at your feet, and then it starts, the feeling of hugging the tree, the emotion that you get in your body, it moves up your body. So if you haven't, prior to the pandemic, been called a tree hugger or been a tree hugger, now may be the time to start, especially for those of you who are quarantining all by yourselves.
Yep. Okay.
And locally and across the nation, people are taking up howling at a certain time of day in their neighborhood. Howling at the day, howling at the moon, howling at your neighbors. I don't know if what you think of this, but it's taking off in our community. Our former mayor, Delray Williams, made a call to local community members to go out and howl at 8 p.m. And here's the upload of the video she made in this neighborhood.
Okay, it's a couple of minutes early. My spouse is out the door. We are in our neighborhood. And yes, I'm the only one standing out here, but that's cool. And so we are doing this for our health workers, and for our grocery people, and for our city workers, and for truckers, and everyone that makes it safe for us while we're doing this, and I'm also thinking about people that are having a really, really tough time from this. And I'm already hearing howling because they have a faster watch than I do. So
Yep.
that is so damn awesome. Yeah, I love this city. I love Moorhead. Ow! 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 There's one of my neighbors. How to do this? Oh gosh. Oh, you get him to be closer to her. But Corley, yay, and Sam, yay! Ow, ow, ow! Ow! Is that Concordia's bell?
Yeah.
Oh, awesome. Okay. Ow, ow, ow! And I am signing off. Thank you all.
Duke, you missed the nightly howling session yesterday and today. Can we hear how you would do your howling?
No.
I thought I was gonna get you there. I thought I'm gonna put him on the spot and I'm gonna make him howl.
Well-
But no, I cannot pull the wool over your eyes. Pardon the pun. Listen, folks, thank you for being with us on a Mexican Crossing Lines with your host Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You've been listening to Lockdown Lunacy on 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. Keep it tuned to our station. Have a great evening and God bless you all.